Did you know the average person takes 7.5 million breaths every year? This is Robert Manni, host of Guys Radio. And on this week's show, our special guest is Dr. Michael J. Stephen. He's written a terrific book about your lungs called Breathtaking. We're going to talk about breathing, we're going to talk about breath work, we're going to talk about COVID, and a lot more. It all begins at 8 p.m. Pacific time on KCAA Radio here in Southern California, 102.3, 106.5 FM, 1050 AM, the podcast, and my YouTube. Drop tomorrow. Guys Radio. Thanks for your support. Not, but we take over 7.5 million breaths every year, and sometimes 600 million in our lifetime. And what goes on in our body each time oxygen is taken in and carbon dioxide is expelled is nothing short of miraculous. Our lungs are the linchpin between our bodies and the outside world, says Dr. Michael Stephan, who's my guest today. And yet we take our lungs for granted until we're incapacitated and suddenly confronted with their vital importance. He's written a book, it's called Breathtaking, The Power, Fragility, and Future of Our Extraordinary Lungs. And Dr. Michael Stephan takes us on a journey with this book to shed original and much needed light on our neglected and extraordinary lungs at a most critical societal moment. Thank you for being on Guys Radio, Dr. Michael J. Stephan, MD.
Thank you so much, Robert. It's really a pleasure.
Well, we were just talking a little bit before we got on the air, touching on different parts of the country and what's going on. So I guess we need to start with COVID, because when you think about the lungs and you think about what's going on, that's a perfect place to begin. So first of all, I want to, on behalf of myself and my listeners and my family, just thank you and the other first responders. People out there need to realize that with all the politics and all the other nonsense going on, that there's people out there putting their lives in danger to save us. And these are the real heroes. You might think Tom Brady winning his seventh Super Bowl is a hero. And sure, he's a lot of fun. But the real heroes are out there putting their lives on the line. So I personally want to thank you, Dr. Stephan, and all of your compatriots for all the work you're doing. And for yourself, I know you actually, by being on the front lines, you caught and experienced a pretty massive dose of COVID. So tell us about what happened.
Yeah, so it all started for me back in April and May. We were put on the COVID wards, and there was great fear in the hospital. For the first time in our lives, in my 25 years of working in hospitals, there was great personal danger. But I will say the credit goes to the nurses' aides, the environmental workers. They didn't have quite the capacity to control their environment like us as doctors do. So I felt like I was watching the modern heroes of D-Day there. They were holding society together when things were really falling apart. We didn't know much about the virus. We had no medicines. There was great suffering and people were dying. But I never, ever saw a schedule go unfulfilled in those 2 months. I never saw a panic. I never saw nobody show up to work. So it was pretty extraordinary to see. We have great workers in hospitals in the country. We have the best hospitals and the best workers in the world.
Mm-hmm. There's no track record with COVID, so it's a little bit different. It's because usually when some new diseases come up, there's a protocol, and you can tell, okay, where this person's case is in terms of what the track record is. And with COVID, we didn't have that. So how did that affect your work?
Yeah, it was kind of just our minds were blown. Our minds were totally blown away. It's like being dropped in a forest with no compass and no GPS, no way to feel your way out. So there was a lot of fear in the hospital. We kind of used a lot of medicines that we probably shouldn't have used, hydroxychloroquine and ivermectin and tocilizumab. But you can understand that. People wanted to do something. They didn't want to just do nothing. They wanted to help. They wanted to feel like we were doing something important. In the 8 months since then, we've learned a lot. We have 2 very good medicines right now. We have a vaccine that's very hopeful. People understand masks more, I hope. And I think we're going to get there. We are going to get there. I had a bad bout of COVID back myself, ended up in the hospital. But like I said, great workers in the hospital, they took care of me, and I'm fortunate to be one of those back to 100%.
Now, with that in mind, it seems like what would be a great idea would be if everybody could have some type of better system of testing. What's your thoughts on that? Because I think that would help not eradicate the problem, but I think if people could test themselves, or there was a fast track way of getting tested that was accurate, it might really help, because it seemed like there was a lot of politics about the testing and people didn't know where to go. And then we had all the, the arguments going on about too many testing means too many cases, and then positive tests and negative tests, and a lot of confusion there. What are your thoughts on that, doctor?
I think you've hit on some very important things there, Robert, and I agree with you. The key to getting this under control is rapid and good testing, and that everybody should have tests in their home right now. And they're not the most sensitive tests, but if you get, some of those negatives may be false negatives, but they're probably good enough to gauge how infectious they are. So even if in the off chance it's a false negative on one of these home tests, the likelihood that that person is infectious is much lower. So I think we need to work on the quality of our tests, but getting people home tests right away where they can rapidly test themselves and have a pretty good idea of where they stand with this virus is going to be very important. Of course, they need to use common sense. If they are really feeling ill and they have a negative test, well, that's a time to ignore it and just isolate yourself and maybe go for a more proper test. But absolutely, we need more home testing. We need more rapid testing. It's been shown that this can help us get out of this, and we just haven't had it, and something to learn for the next one.
So, as somebody who contracted the COVID, what was it like? How did you know that you may have it? Obviously from your work, but what are some of the early symptoms that set the alarms off for you?
So, the thing that's maddening about this disease is, and I talk about this in my book, is that, a quarter or a third of patients are completely asymptomatic. And so they don't know, and there's no way to know. Except, maybe a little fatigue, and that's the time to jump on a test with any symptoms or any exposures. For me, I came home, I felt like somebody took the batteries out of me, and a few hours later I had a fever of, almost 104. So it was pretty obvious in my case. But you do have people all the way in between: loss of smell, loss of taste, a little mucus, some diarrhea. So people just have to be very careful, and we need to have a very low threshold for testing.
Do you always get a fever with this?
You do not. No, certainly not.
Okay.
And there's just a wide spectrum of disease. And some people have, like I mentioned, up to a quarter have absolutely no symptoms whatsoever. They're these asymptomatic carriers, and they bring it around. So, how do we figure out just testing everybody?
It's interesting. My next question is going to be about how often we get tested. I'll give you a little story. Back in October, I had and I'm an adult, obviously I'm a boomer, and I had what I didn't know was an appendicitis attack, and I had to go to the hospital, and they found out that my appendix was infected, and it was going to affect my bloodstream if they didn't get it out right away. So outside the hospital, before I went into emergency, they tested me, and then I had the procedure, and it's been a battle coming completely back because I took very, very powerful antibiotics that they give you for anthrax and things like that. But I haven't been tested since then, and I feel great. Should I be getting another test?
I don't think, if you feel great and you haven't had any exposures, I wouldn't test you. The two times that are very important to get tested are any kind of symptoms. And I mean anything, right? Nasal stuffiness, lack of taste, any diarrhea. So any new symptoms, I would go ahead and get tested. And then any exposures. So you know that you are around somebody who had it. And if you're clear of those two things, you feel great, you've been going out about your business, you've been isolating in your pod, and everybody's been doing well, then no, there's no indication for a test there.
Now, I don't want to put you on the spot, but with masks, I'm reading about now, oh yeah, wear 2 masks, wear 3 masks, this mask is good, this mask is not. I mean, when we started out, we didn't know how long this was going to last, and my wife and I and my son, we were wearing bandanas, and then we realized, no, we got to get the real masks here. So we've been buying different ones, but what are your thoughts, if you have any, on recommendations on masks?
It's a difficult subject, but I think there are very clear recommendations, and I think the recommendations are very helpful. So the CDC has come out and said you need a multi-layer mask. So that's sort of a basic surgical loop mask. It's not a super tight-fitting N95. And for most circumstances, I think that's probably fine. Like you're walking outside, downtown, and there's people around. You're on a subway maybe. And you're 6 feet apart from somebody, I think the surgical mask, which is a multi-layer mask, should be okay. When you're under higher risk places, say you're indoors, and you cannot avoid being indoors, then that may be a time to wear 2 masks, where you have, an N95 airborne type mask, which filters out smaller particles and airborne type particles. And then you have another surgical loop mask on top of that, That may make sense in those high-risk situations. Say you're going to a hospital and you're seeing a loved one that you cannot not go see, or you're in an indoor situation where there may be other COVID people around. So we don't have definitive answers, but I would use some common sense and avoid congregation. Wear a basic loop mask, which is a multi-layer mask under low risk circumstances, and consider 2 masks under other circumstances.
Got it. My special guest on Guys Radio is Dr. Michael J. Stephen. His new book, Breathtaking, The Power, Fragility, and Future of Our Extraordinary Lungs. We're going to get into the book, but I figured, everybody wants to know as much as they can from an expert about COVID. So 1 or 2 more questions on COVID, and then we'll move to the book. It seems like there's secondary strains and all these different strains from around the world. Where do you feel that the medical community is on this? Do we have a handle on this thing, or is it just going to keep going? And if so, how long, not on the record, but how long do you think this thing is going to keep going before it kind of peters out?
Yep. So we don't know, but I do know that we have a huge opportunity right now to crush this. We know what we need to do in terms of isolation, in terms of masks. We have a very good vaccine, which is working in the vast majority of cases. So we have a window here, and we have to take advantage of it. If we don't take advantage of it, then this virus, we don't know where it's going to go, right? Could it adapt to us and become benign and kind of peter out almost on its own? It could. Could it become nastier, and could our vaccines be not quite as effective, which we're seeing a little bit now? It could. The vaccines, one thing to keep in mind is in the press, they really throw out numbers for preventing disease completely. But what we really need to prevent is hospitalizations and deaths, like we do with the flu vaccine. So even though the South African vaccine seems to evade some of the defenses, if it's good at cutting down severe disease and deaths, then that's still okay. And we don't have all the data on that and all the strains, and we don't know. But my recommendation to everybody is now we have good vaccines right now. I don't know how long they're going to last. We have good ideas of what's going on. So let's just all band together and crush this thing right now.
Got it. There's always talk, from the medical community, you're focused on treatment, and then for the individual, I think people need to be focused on prevention. You can't expect your doctors to do, the behavior for you. You have to do preventative things, no matter what the disease is. You have to take care of yourself, build up your immune system, et cetera. There's not a lot of talk about that, but you can't expect your doctor to do that. They're going to treat you when you have symptoms of something. So I hope you don't take that the wrong way, doctor. But what, in your opinion, since you've seen so many people, what do you think people should be doing beyond the social distancing and the hand washing and the wearing the mask for prevention and strengthening their own immune system so they avoid not just COVID, but other diseases and keep themselves as healthy as possible?
Yeah. So there's a huge amount of that you can do to take care of your lungs. If you're on tobacco or nicotine, maybe this is a little bit of a wake-up call to really motivate you to try and get off of those substances. They're highly, highly addictive, more so than heroin in most people. But get some help, get some nicotine replacement. Now's the time to think seriously about, tracking pollution on your smartphone and not going out and exercising when it's a high pollution day. Think about, environmental allergies within your house and at work. When you're cooking with a lot of oils, make sure a fan is on and there's good ventilation. Think about your weight, your diabetes, and your hypertension. So, I'm hopeful. I'm like to think positively that this is a good time for people to take really good care of themselves, to take care of their lungs, to analyze their atmosphere, and how to really knock down these risk factors. There's a ton you can do.
Got it. Okay, let's talk about the book, Breathtaking. It's amazing. You've written a really deep, interesting book about lungs. What attracted you originally to pulmonary medicine, and how did you get inspired to write this book? Because I don't think there's anything out there that's like this. And great job, by the way.
I appreciate that. And you're right. It's a deep dive into pulmonary medicine. There's been other books written about cancer and about the blood and the heart. But lung medicine has been somewhat ignored, and I do a deep dive into all aspects of it, why we need our breath. Inspiration is the right word, inspire. Our lungs are what defines us at the beginning of life and at the end of life as well. I started getting interested in lung medicine and ICU medicine when I started in the intensive care unit as a resident in Boston in the early 2000s, pulling these very, very sick patients back from the cliff with expert doctors and nurses and respiratory therapists, and seeing them restore the breath was so inspiring to me that I wanted to make a career out of it, and I wanted to bring word about lung medicine and the right to a clean breath to the world. My passion.
Since smoking has continually declined, at least in the United States, what are the newest challenges that doctors like yourself, are now facing with the lungs?
So tobacco is still a huge issue. Over 32 million people in this country still smoke, and vaping.
That was my next question. Thank you.
Yeah, vaping cut into our gains of tobacco cessation extraordinarily, especially in the high school crowd. And if you're going to get addicted on tobacco before age 18, it's going to be so much harder to get off later in life. So there's tremendous challenges still with nicotine. We've made a lot of progress since the 1960s, when rates of smoking were 50, 60% in this country. So we've made a ton of progress. A long way to go with lung cancer and COPD. Pollution is a big issue. Every year since 2017, the American Lung Association has said our air has gotten worse. Quality of our air. This is due to climate change. This is due to pollution, to wildfires, to increased ozone levels. So there's a lot of work to do there. Environmental allergies are on the increase. Asthma has increased tremendously. So there's just a wide swath of diseases. I talk about them in my book. I do a deep dive there into where we've come and where we need to go to get a handle on our breath. COVID's just a symptom of the disease. It's just a symptom. And another crisis will come along as similar to COVID, if not worse, if we don't get on top of this stuff.
Now, I do Qigong, which is deep breathing, and I want to get your, and it's interesting that I go out on my deck, I'm in San Diego, and sometimes there's a marine layer in the morning, and I'm taking really deep breaths, and I'm like, should I be doing this? So what are your thoughts on some of the deep breath exercises, and how can we use the smartphone, I guess, to measure the pollution level before we do some of this stuff, or running? Like, I'm in Southern California. I ran 1,000,000 times in New York. I'm running out here. It's a little bit of a different experience, but what do I need to know?
Yeah, I would absolutely. It's a function on our smartphones now is pollution levels, and it will give you a pollution meter, good, bad, and it will tell you, should I be exercising outside today as somebody over 60 or, under 10? The elderly and the very young are most susceptible to effects of pollution and outdoor allergens and noxious stimulants. The lung cells are just not functioning as well, and things can get in there much more seriously. So absolutely check your smartphone, check a weather app to check on pollution levels to see if you want to be exercising outdoors that day. If not, then that's a chance to take it indoors. Absolutely.
How about for the folks who've become non-smokers? Now, I know in the case of my aunt smoked Pall Malls for like 30 years, and then she quit, and then 6 years later she got cancer and she passed within 6 months. Some people stopped smoking like 30 years ago. Should they be concerned now, or is there a time frame where you can feel a little more comfortable? Obviously, not smoking is the best remedy, but
Yeah.
Can you detoxify basically? Or is that material still in your system for how long? And if so, for how long?
Yeah, so within days, what I tell my patients, it's never too early or too late to quit smoking. And the sooner you do it, the healthier your lungs will be. And yes, there is a time frame where they do heal. So within days, things calm down in terms of asthma. Heart disease returns to a normal level after several years. In terms of lung cancer, it's generally thought that if you've been smoke-free, anywhere from 15 to 20 years, that your risk for lung cancer drops down pretty close to just an average person's risk for lung cancer, which is not zero, even in non-smokers. So if there's an opportunity to quit smoking, I would take it, get off cigarettes. It's never too early or too late. And certainly over the years, your risk of different smoking-induced diseases declines. And it's not zero, and depending on how much you smoke, but certainly if you get 20 years out from tobacco, you should be feeling pretty good about yourself and your health.
Okay. In that same vein, if people do contract lung cancer, it used to be thought of as it's definitely a death sentence. It's over. Now, maybe not as much. Have things changed for the better there, doctor?
Things have changed slowly for the better. Lung cancer is one of these diseases. It's not like colon cancer, and I compare these two in my book very deeply. Colon cancer grows at slow and predictable levels, so you can get your colonoscopy, you can get your screening. Lung cancer very often presents as very advanced disease where the treatment options are limited. About 5-10 years ago, there was appropriate screening mechanism in place put in for lung cancer, and that's a yearly CAT scan if you have smoked, at least 20 pack years within the last 15 years. So that's progress. That's cutting down slowly on lung cancer rates. There's newer medicines, immune-based medicines where you activate the immune system to attack these lung cancer cells, and that's been shown to be quite effective in certain cases. So certainly prevention is the best way, but lung cancer treatments have come a long way. Lung cancer rates are finally coming down. The past couple years come down about 5% a year, and so that's vastly encouraging. 100 years ago, there was zero lung cancer, and we need to work hard to do better progress, no question.
There's a spiritual aspect to the lungs, and you touch on that in the book, but I know there's a yoga practice, pranayama, I think it's called, pranayama, and it's about the spiritual meaning of lungs and breathing. Are you familiar with that? Do you have any thoughts about the spirituality aspects of the lungs as they kind of give us life, if you will?
Yeah, so this has been in all cultures throughout all time. It's been in Judaism with the concept of ruach. It's been in Christianity, the concept of the Holy Spirit. God breathed on his disciples, giving them life. And we've gotten away from it a little bit in the West, whereas in the East with pranayama, they understand that a path to wisdom towards nirvana is through a careful study of the breath. It's something that can ground you in times of stress. It can help stimulate the diaphragm, stimulate those feel-good hormones like serotonin and dopamine, and really have a profound effect on your life in a positive way. And we've studied this both in the absence of health and in patients in the absence of disease, and in patients with diseases like asthma and COPD and even PTSD and cancer. So there's a lot more research we need to do about this, but there's thousands of years of evidence that breathing exercises can really improve your life.
Okay, our special guest on Guys Radio, Dr. Michael J. Stephen, MD, the book Breathtaking, The Power of Fragility and Future of Our Extraordinary Lungs. I'm loving this conversation. What is the biggest surprise you've learned about the lungs while doing your research for the book?
I developed a new appreciation for how strong our lungs are, how resilient they are. That you can smoke for 30, 40 years and the chances of you not developing cancer or COPD are higher than what you are. That we can expose ourselves to this vast amount of pollution and waste, and the lungs, despite being mostly air, are resilient. We have reached a tipping point, though. There's only so far that you can push this beautiful organ. Another thing I will say is, it's not just a simple organ pushing gas around. It's alive with cellular movement in and out, and it's alive with immunology and chemistry. It's this very beautiful organ that gives us life. It's the only organ in constant communication with the atmosphere. So it's constantly exposed to all these pollutants and noxious stimulants and viruses, but it's still able to do its job. And it's a shared space between everybody. And so it needs to be respected, and hopefully COVID can drive some of these lessons home to us. So it's a beautiful organ, it's resilient, and I just developed a bigger appreciation for that writing the book.
Okay, COPD, and I know you've done a lot of work with cystic fibrosis. For the benefit of our listeners who may not be super familiar with either one, they may have heard the name but are not exactly sure what these diseases are. Could you explain them for our audience, please?
Sure. So COPD is probably, it is the most common lung condition causing deaths in this country and worldwide. And most of it's from smoke exposure, but you can also get COPD just from pollution and hanging out indoor pollution. And it's just a slow destruction of the lung tissue where you just cannot appropriately do gas exchange. Carbon dioxide out, oxygen in. That's why you see these people with oxygen tubes on walking around, and it saps the life out of you. So it's not just a lung disease, it's an inflammatory disease of your whole body. It's hard to get nutrition in. It affects your brain and your whole quality of life. There's good inhalers for it. Lung transplant is an option, but certainly COPD is the #1 lung killer in the country, and there's a lot more we need to do on it, which I talk about in my book. Cystic fibrosis is the most common lethal genetic disease of Caucasians. So 1 in 25 Caucasians will have a gene for CF, so it's quite common in that respect, but you do need 2 genes to get it. There's about 35,000 patients in the country with it, and it's just too much mucus in the lungs. There's a defective protein and a lot of mucus, a lot of bacteria. But patients in the 1950s were living to age 5, and now with new medicines, they're living over age 50. So it's been extraordinary progress on cystic fibrosis, and the Cystic Fibrosis Foundation deserves a ton of the credit for getting all of that work done.
Okay. Let's just touch on pneumonia real quick. I had a case of pneumonia about four years ago, and I couldn't shake it, and I went to the doctor, and he gave me some type of Z-Pak or something, and all of a sudden, boom, 3 days I was on my way to recovery, and that was it. So it's I understand it's a viral infection, and I guess that's why 100 years ago people got pneumonia and they died, because you can't shake it. What are your thoughts on pneumonia?
So pneumonia is very, very tricky. It's lower, pneumonias are the #1 killer
And
worldwide.
how do you get it, too?
You inhale a bacteria, a noxious bacteria or a virus, and your body can't fight it appropriately, and it divides in your lungs out of control, and you get a lot of white blood cells in there to fight it, but they're not effective, and the virus or the bacteria gets the upper hand, and that's what kills you in COVID most of the time, is a pneumonia. And sometimes you give antiviral medicines like remdesivir, or you'll give azithromycin if it's a bacteria to help augment that killing of the bacteria or the virus within your lungs. So yeah, pneumonias are infectious particles that have evaded your defense systems, the defense systems of your lung, and if they take over your lung and you can't breathe, then yeah, that's going to be very tough to live with.
Do people breathe correctly? Because I think with all the anxiety and stress out there, there's a lot of mouth breathers and a lot of short breaths. And is there anything that you would recommend that people should do to kind of be more mindful about their breath?
Yeah, breathing with your diaphragm is so important. Starting at the nose, if you can breathe with your nose and you don't have an issue with it, the nose filters out noxious particles. It warms the air. Some people have cold sensitivities to the air. A mask can help with that. So certainly nose breathing is generally preferable, as is breathing with your diaphragm. Most of the blood flow in your lungs, and I talk about this in my book, is at the lower part of your lungs. So if you can breathe with your diaphragm, what happens as we get older, we get stressed, we breathe with our chest. A lot of our stress goes up there, and that's ineffective breathing. That's not doing good gas exchange. So we need to get back to breathing with our bellies, to working towards a healthy weight, so we can expand that diaphragm, move that belly out of the way, and take nice, easy, deep breaths to stimulate our vagus nerve and make our brain happy.
Okay. You mentioned asthma briefly earlier. Why is asthma, I think it's on the rise now. Why do you think that is? Is that air pollution?
Probably part of it. We don't have all the answers. There's just so much mystery in lung medicine. Asthma rates in this country in 1980 were 3%. Now they're over 8%. They're over 12% in certain populations of kids. There's actually more allergens today than ever. There's been a global greening of the atmosphere. There's more vegetation in the world now, 20% more vegetation with all the extra CO2. The plants love that for photosynthesis. So there's more plants, there's more allergens. We're having shorter winters. There's just more pollen and pollution around. And what else is contributing? We don't know. It could be something else totally different that we have no idea. We can't see the stuff in our air. We need to do more research on it.
With athletes, it's interesting. I've run 3 marathons, and in each case I'd say, how can that person be running better than me? I'm struggling, and that person who looks totally out of shape just seems to be, cruising along. And obviously their training regimen and their experience is part of it. But you look at somebody like Lance Armstrong, supposedly beyond the whatever extra help he got, but he had this capacity to oxidize his I don't know if it's his blood but his body could use the oxygen very effectively, as some super athletes can do that. What is that all about? And is there anything that the Sunday, the weekend warrior athlete can do to uptick their capacity for their lungs for their training?
So, those people like Lance Armstrong, those super athletes, they have what's called very high VO2 max. They are able to pump blood by their heart very efficiently, and then once it gets to the tissues, they're able to use that oxygen by their muscles very efficiently. And there's a genetic component to this, and some of us just are better at that than others. And these are the people who end up in the Olympics. For everybody else, to increase your fitness, no super easy answers here. Just slow, steady cardiovascular work if you're a runner, if you're a swimmer, getting in the pool and helping condition your heart and condition your muscles so they can extract oxygen as well as they can. But absolutely, there's a genetic component, and some people are just better at it and more efficient and able to get in shape quicker than others. But for everybody, there's no ceiling, I don't think, in terms of exercise. And we're seeing what Tom Brady, you picked up Tom Brady. He's 43, 44 years old, and the best quarterback in the NFL. So we understand that a lot of these issues with aging and muscle decline can be reversed. And the same is true for breathing. We use our muscles of our chest so much for breath. And if we keep those in good shape, we can overcome any decline in our lung tissue that happens. So we're just learning extraordinary things about the body, and we're just pushing the limits of a generation. In a generation that's changed, a 43-year-old quarterback would be unheard of. And certainly, he's very disciplined, and he's in the top 1/10 of 1%, but he's a light of what is possible.
Okay, just a couple more questions, and I got to tell you, I'm loving this conversation with you, doctor, so thank you. Number one, sleep. We spend half our lives laying in bed sleeping. Is there anything we can do? So we're breathing the whole time. Is there anything we should know about better ways to sleep that are better for our lungs?
Yeah, sleep is another one of these huge mysteries. There almost aren't even bad ideas about why we sleep and why we dream and consciousness and things like this. But we know we need it, and we know it's restorative. One thing I will say, that there are things that interrupt good sleep. Even one or two drinks can affect the quality of your sleep. So, one or two alcoholic drinks is generally not harmful and can be good cardiovascularly. But in terms of sleep, it can affect your sleep quality a little bit. And getting enough sleep affects your immune system too. They sleep starved these rats, and they died of infections. It affected their immune system in such a significant way that they died of infection. So once I had a professor ask me why I was falling asleep, I said, "No, I'm just trying to stay alive here. I'm sorry." But that didn't go down too well. But sleep is so important to us. An important night's sleep is so important. Watch out for sleep apnea. If your partner notices, you're waking up choking, or you really don't have a restful sleep, then that's time to see a sleep doctor and maybe get a sleep study to evaluate what's going on there.
Okay. What are the 5 things, I think you've mentioned this in other interviews, that people need to know or should know about their lungs that could help them?
So there is a natural decline that does happen in lung function, but it can be reversed. So I would say that's very important. Number 2, look out for pollutants, both at home and in the work, and keep an eye on pollution in the atmosphere for exercise type days. Number 3, breathing problems are very often the lungs, but you also have to look at the heart. You have to look at anemia as well. So seeing a physician who really takes control of your case if you're having breathing issues is very important. For COVID, important thing to know is, isolation, masks, and get the vaccine. And we have a huge opportunity to crush this. And, enjoy life and enjoy your breath. They're the organ that defines our existence here. They can help you get a tremendous amount of light out of life if you take care of them.
Okay, my special guest, Guys Radio, has been Michael J. Stephen, MD. The name of the book, which is fantastic, Breathtaking, The Power, Fragility, and Future of Our Extraordinary Lungs. Dr. Stephen, please tell everybody where they can learn more about you and your book and what else they need to know.
So you could go to my website, mjswriter.com, and read about the book. Go to my publisher, Grove Atlantic. There's a page for me there, and certainly it's available, Amazon, Barnes and Noble, and hopefully local bookstores as well.
You think there's going to be a volume 2?
I hope so. I think there's still a lot more to say and a lot more to learn about the lungs, and it's been a fun ride, and it's been great.
Well, listen, I want to thank you personally and for the benefit of on behalf of our listeners, because you're a hero in what the work you're doing on the front lines, and you're a guy's guy, and you were a very special guest today and very informative, and I really appreciate your being here. So thank you, Dr. Stephen.
It's been a pleasure. Thank you so much, Robert.